Good afternoon, everybody. Welcome to our monthly roundtable. We're very excited today. We're going to talk about treatment options. And many people crash into dialysis and they may not be aware that they have treatment options other than actually going into an in-center hemodialysis unit. So today we have with us Joanne Smith from Fresenius, and of course our medical consultant, Dr. Velma Scantlebury. I don't think Dr. Scantlebury has joined us yet, so I will facilitate until Dr. Scantlebury joins us. And Joanne, thank you so much. Joanne Smith, RN, kidney care advocate, Fresenius cheerleader. Could you just tell us a little bit about what you do
Sure.
and exactly, how you go about doing your daily things?
Yep. So my name's Joanne Smith. I have been a dialysis nurse for 30 years, um, part-time with DaVitas and the rest of the time with Fresenius. I have been a clinical manager for about 10 years. And then for another 10 years, I was a home therapies program manager where I taught people to do dialysis at home. And now I'm a little bit older, so I spend most of my time doing the education piece. So I meet up with CKD or chronic kidney disease patients that are referred by their nephrologist, and we have classes. And basically I just go over a little bit about diet, a little bit about the progression of kidney disease, and so just some facts. And then we get into the heart of the matter, which is the different options. It is interesting, like Nancy was saying earlier. A lot of people have no idea that there are different ways to do dialysis. Some people will say, they know about home dialysis, but it's the one in the belly. But, in fact, there's two ways to do dialysis at home. I don't know. How far do you want me to just keep going and talk about?
Just one second. Did Dr. Scantlebury join us yet, Hannah?
No, not yet.
Okay. Well, if you could let me know. Sure, Joanne, go into it because I can talk about myself first and then you could take it from there. I met
Okay.
you in 2004 when I was on dialysis, and I was one of those people that crashed into it. And I had no idea that there were so many options. So I'm hoping now, I'm talking 21 years ago, and I'm hoping now that people are being more educated about the treatment options that they have. Um, and I'm not sure that information is being told to patients that go on dialysis, because it's frightening enough when you go on dialysis and then not to know all of your options. That can really be a problem. So do you think that the education process is better now than it was years ago?
Oh my gosh, absolutely it is. Absolutely. So, what I do now is a full-time position. I used to, as a home program manager, I would do, spend maybe 10 to 12 hours a week doing some education with patients. Now it's a full-time position. So that's what
Mhm.
I do that full time. And it's really well organized. It's a lot of communication between the nephrologist and having them refer patients to me. So a lot of times patients will get to stage 4 or even stage 5, and the nephrologist wants them to come and meet with me. I actually will bring them into a dialysis clinic and then talk about every option. So the in-center option, peritoneal dialysis, and home hemo. And then we touch on transplant as well, because transplant is an option, right? So it's not a cure, but it's an option, just like dialysis, the different types of dialysis. But yeah, absolutely. If you can look at the numbers, so I'm in Delaware, which is, one of the smallest states, and we have almost 25% in northern Delaware of dialysis patients are doing home dialysis. So absolutely a large improvement. Yep.
Okay. So, Joanne, when you say home dialysis, we have to differentiate, because a lot of people don't know the difference between peritoneal dialysis and home hemodialysis. So, can
Correct.
you explain that to us?
Yep. So, right. So people are terrified. Actually, I personally was terrified at the thought of people doing home hemodialysis at home. But then I was educated on the benefits and just how easy it actually really is. I mean, once you get past the cannulation or putting the needles in, basically it's setting a machine up and learning everything you need to know about assessing yourself, how to run a treatment, what to look for. But the hemodialysis is similar to what people do in the clinic 3 times a week. But when you do home hemodialysis, you have the opportunity of doing dialysis more frequently. And a lot of people will say, well, I don't even want to do it 3 days a week. I don't know why. Why would I want to do it 4 or 5 days a week? But what you have to realize is when your kidneys are functioning, they function 24 hours a day, 7 days a week. And when they stop functioning and you drop down to getting your blood cleaned 3 days a week, that comes with some side effects, as a lot of people know, right? So they're washed out, people's blood pressure drops, and it's difficult restricting, your fluids and your diet. But with home hemodialysis, most people will do 5 days a week. And depending on their body size, they'll do it for about 3.5 hours. But what's really nice is once they're trained, they can pick and choose when they want to do their dialysis treatment, right? So they're not locked into a permanent schedule. They can live their life and have, some quality to their life and actually do the dialysis around their life schedule versus living their life around the dialysis clinic schedule.
That sounds great.
Yeah.
Now, Joanne, what would make a person not a candidate for home hemodialysis or PD?
So a couple things. With peritoneal dialysis, we have lots of folks that just do that on their own. In fact, I have a good friend of mine. She's 85 years old. She's been on PD for 15 years, lives alone, and does a great job. But for peritoneal dialysis, we're actually using the abdomen, right? So it's called the peritoneal membrane. And if you look up peritoneal membrane, it'll talk about the kidney you never knew you had. So when we use that, it's a more natural way, a slower way to do dialysis. Most people will do that overnight while they sleep for at least 8 hours. But if you've had like multiple surgeries on your abdomen, which create a lot of scar tissue, or possibly sometimes if you have an ostomy or some sort of high infection rate, a lot of times the nephrologist will not want, or even the surgeon will not want people to do peritoneal dialysis, just because the risk with PD or peritoneal dialysis, the biggest risk is infection. Certainly, we train everyone how to avoid every risk for infection, but you want to start off like basically, I mean, if you've had a couple of surgeries on your belly, there's still a possibility. But I like to send people to the surgeon, let the surgeon check out, what's going on in the belly. And, if you have hernias or something like that, certainly they can repair them and you could still be a candidate. And for home hemo, and then, you have to think for home hemo, we like people to start with a permanent access, either a fistula or a graft. But we will train people with the temporary dialysis catheter. So what makes somebody not a candidate? So depending if somebody's dexterity is not there, like if as far as putting needles in, if they don't have the dexterity or the bandwidth, in other words, or if they are unstable during the treatment, for example. If people's blood pressures drop or if they're incapable of making, intelligent decisions, so all of that is assessed. And then they are recommended or actually told, yeah, you can, or no, you can't. But the whole process, I mean, so when you do peritoneal dialysis, usually people train for like maybe 5 to 7 days. It's that easy. And the big focus is on infection prevention. But when you do home hemodialysis, we routinely train people for anywhere from 4 to 6 weeks. So they come to the home training clinic, they get their dialysis treatment, and then each day they're with a nurse who will train them just a little bit each day. How to set the machine up, how to create the purified water, how to clean their access, how to put the needles in. What if this happens? What if that happens? So it's a much longer process. And during that process, some people will not make it all the way through the training. They'll decide it's not for them, or along with the nurse's assessment, if they're a good candidate or not a good candidate.
So do you have to have any kind of special plumbing, or do you come out to the home to get them started?
So what we do is for home hemodialysis, we will actually do a water sample, right? Because you're going to create purified water using your own water. It comes through a filter and a packet, and it creates the water that we need, or the dialysate we need for doing hemodialysis. So we will come and test the water and make sure that, your water is a good quality. And if it's not a good quality, we have an alternative. We have hanging bags that we can use. But if it is, then we will send a plumber out. There is a lot of tubing, and we don't want to create a trip hazard for people. So a plumber will actually come out and attach a drain line and a water fill line, just to make sure that it's up and out of the way.
Okay. And is that done in the kitchen sink or the bathroom sink?
Could be anywhere. It could be kitchen sink, could be, depending on what as the closest access for water is, and the plumbers do a great job with that, keeping things out of the way and making sure that it's not going to make anyone trip, or it's going to be a good setup. And as far as PD, you don't need, so PD is pretty well self-contained. We send the solutions, you have the machine, or you do it manually, but you don't really need anything extra for peritoneal dialysis.
Okay, great. And many people live in apartments.
Mm-hmm.
Do they have it? What about storage for all of
Yeah. So that's actually one of the biggest obstacles, believe it or not, but from my perspective and my experience, if somebody wants to do home dialysis, they're going to figure out a way. We will go and do a home visit and kind of make suggestions, or like I just tell people, if you can kind of think about how much space a washer and dryer take up sitting side by side, that's the amount of space you're going to need to store supplies. And it has to be inside. You can't store them outside. And you do want to store them close to where you're going to do the dialysis, because you don't want to be lugging all those supplies back and forth. But we do occasionally have what we call an every 2-week delivery, which means that you'll get, half your supplies one week, half the other, and then the downside to that is, when the delivery guy comes, you have to be there. So, there's a lot involved, but, you can creatively like store supplies under the bed or in the closet, or, we have people that live in mobile homes and they make it work, and it really is, so depending on how motivated you are, we could help you out making that work for you.
Right.
Yep.
Well, I remember a couple of years ago, I heard you say that you even had truck drivers that drive trucks.
Yeah.
And
Oh, yeah.
dialyze in their trucks.
That's correct. So they can do manual, right? So they're not going to bring a machine with them, but they can do what we call a manual exchange. Manual exchange takes about, maybe, I tell people, give yourself about a half hour, but basically it has to be a clean area, and you need to have a mask on and clean hands. And you basically will drain out fluid that's in the peritoneal membrane for about 10 minutes, and then you fill up for another 10 minutes, and then disconnect, put a new cap on, and then throw the drain fluid away when you get to a toilet or a bathroom. But yeah, it's people, take it on cruises. They, it's really, I can't imagine. As long as you have a clean area, as I can't imagine you not being able to do PD anymore. People actually take home hemo, the next stage machine. We use the next stage machine. People take that camping, and they take that on cruises. People, they're living their lives on home dialysis.
That is so great to hear.
Yeah.
Now, we've talked about PD. We've talked about home hemo. Of course, I think everybody is aware of in-center.
Right.
And the thing about it is we have a Kidney Citizen magazine, which you are familiar with, and we're talking about treatment options, and that should be out in about a couple of weeks. One of the things that they also mentioned, and of course we don't ever hope that people have to do this, but it does exist, palliative care. Can we talk a little bit about palliative care?
Absolutely. So, I mean, if you want to think about people with kidney disease are people, right? They're regular people and they have just as many other problems as other people. And then they have kidney failure on top of that. But I mean, so sometimes it's too much, right? Sometimes people just, because they do dialysis either home or in a clinic, it's not going to provide any better quality of life for them. In fact, it'll be more of a burden for them than when you weigh things out. So some people will choose to do palliative care, and basically that's hospice. So what happens is, your kidney doctor will work with you to give you medications to, kind of keep you as dry as possible, not, to be filling up with fluid, and to keep you comfortable as possible. But basically, a last option. But people have the right to choose that. I mean, I've had some people choose that and then, at the last minute pull back and say, wait a minute, So I kind of tell people, absolutely, you have the right to choose that if that's what, and not to feel pressured. But just to know, there's a YouTube video actually that Fresenius made with myself and an older gentleman, and his name's Joe Gatto. It'll show you, he was not going to do dialysis at all. And then his wife and daughters came to a presentation, and he decided he was going to try PD. And he actually was in his 80s, mid 80s, when he first came to me, and he ended up doing PD. And he talks about what a great decision it was for him. And he traveled and did some things that he wanted to do. People get overwhelmed at the thought of, a lot of people will say home dialysis, they know bad things about what happens in the dialysis clinic, and they can't even imagine, for them to do that at home. It's terrifying, and
Yeah.
so it just takes time, and people need to be educated. That's all.
Right. Well, I would be remiss if I did not mention that Joanne is so dedicated to what she does that she's also a kidney donor herself. She donated a kidney to one of her patients. How many years are we talking about now?
Yep, August was 10 years.
10
So,
years. My goodness.
look,
Well,
well, I have to tell you the stories, right?
you
So
got a lot
that
of
was that.
hearts on
Yeah,
that one.
that was not me. That was
You
all
got a lot of
God.
hearts. I don't know if you can see the hearts on the screen or
I
not,
can see. Yeah,
but that is
I
so nice, everybody. Thank you
yeah.
so much for
Thank you.
doing that.
Yeah. So that was all. That was a God story for real.
Yeah.
I like I said, I was a dialysis nurse at that time for 20 years. I never thought about donating a kidney. I should have, but never thought about it. And honestly, standing in line for communion, God put one of the patient's names in my head, and I was like, "Are you sure?" So I went to the transplant center, and I had the evaluation. It was a perfect match, and so now this guy was, he was on dialysis for about 4 or 5 years. He's not been on dialysis for the last 10 years, and I'm pretty healthy. Let me knock on something here. My labs look great. I feel great. No restrictions. So as part of when I educate people, I do talk about that. And I tell them, I said, if you have somebody interested in donating, please have them call me. I am happy to talk to them about my experience. We really need to, push for living donors, because that actually is the way that more people can get transplanted. Right.
Yeah.
And yeah. And there is a big fear for people to donate. They're afraid of what about that's going to happen to them. But I'll tell you, the evaluation process for a donor is awesome. I mean, it's very thorough. They pretty much can almost guarantee that, if they clear you to donate a kidney, you're in good shape, and that there's very minimal risk that you're going to end up needing a kidney. So, and if you do, you go to the top of the list. So they got everything covered. It's pretty awesome.
Yeah. Well, Joanne, you are a very special person, and I'm just really proud to say that you're one of my dearest friends for many years. And whenever I need information about home dialysis or anything like that, you're my go-to person. And I know your phone number by heart. So but I want to we've got about a good 10 minutes left. And I
Okay.
just want to give you a scenario of how we would go through this and listen to this. A patient transplanted for 10 years, the kidney rejected. The person cannot go into a home hemodialysis center because they don't feel that they have the freedom. So they're ready to go on PD. How do you talk to that patient? Walk them through that process.
So the first thing I would ask them, if are they a candidate for transplant, for them to encourage them, if they are, to kind of do the workup and get back on the list. The second piece I would talk about is, so with a kidney transplant, that kidney is placed in the abdomen, right? So it's placed in the front, and then depending on what other surgeries they may or may not have had throughout their life, I would certainly I would set them up with a surgeon and have a surgeon, do an assessment to make sure that they are a good candidate, that there's not a lot of scar tissue, and that that PD would work for them. But I would sit with them and explain the whole process. I mean, it's really, and I tell people I could train somebody to do PD in probably a couple of hours, but we train people a good solid week, and it's mainly about infection control. So we want to make sure that you're comfortable doing the procedure and that you're not going to get an infection. And the nurses are on call 24/7. So if you have any issues or problems, a lot of times I will go to someone's house if I'm having a hard time meeting up with them, or I can't, we can't find a suitable time. And then when I'm there, I'll kind of look around and we'll talk about where will you put this, and where will the supplies go. It just, and then if you think about PD, the majority, we do have a handful of people that do manual, but the majority of our folks do their PD overnight while they sleep. Their days are freed up. They're doing dialysis every night while they're sleeping. So much less restricted on their diet because they're doing dialysis every night. And a lot of
Mhm.
times, people will continue to put out urine for a much longer period of time because PD is such a gentle type of dialysis. And just to let them know that, you always have the option that if you start on PD and you don't feel that's for you, what we then do is, get you set up for a fistula and either encourage you to do home hemo, take a look at that, or do in the center. But there's a lot of options and it's kind of a cycle, right? So,
Mhm,
yeah,
mhm.
yeah, there's no guarantee, just like, transplants have gotten much better, but there's not a guarantee, right? So,
Exactly. So,
yeah.
Joanne, what do you see for the future of in-center dialysis?
Well, there's always going to be a need, because we do have a lot of people that, may not have family members or may not be capable of doing dialysis. It's tough there's a lot of staffing issues. Um, I'm not sure. And as far as the government paying, who knows what's going to happen.
Mm.
I mean, what I would love to see is I would love our country to do a better job educating people on the front end, like about nutrition and, because we know that the majority of people with chronic kidney disease, it's directly related to diabetes and or high blood pressure. So if
Mhm,
we could get those two things under control, we could dramatically decrease the number of people needing to do dialysis.
mhm, mhm.
Yep.
Exactly.
Yeah.
Well, I think we have gone through everything. I don't know if anybody who has joined us would like to ask a question, but if you would like to screen up, you could do it at this time and, take advantage of an expert with any questions that you may have because you may not get this opportunity again. So if there's anybody on here that would like to ask a question, by all means, do that right now. Okay. Well, I guess everybody is very educated.
Awesome.
They don't need to ask any questions. So,
Yeah.
Joanne, could you just give us a summary and some kind of I just think that, years ago, dialysis, we didn't have choices. We didn't have options. Um, we didn't even last as long.
Yeah. Yeah.
And now, it's something to look forward to as far as, knowing that you'll have a better quality of life.
Mhm.
Because I think every day they're doing things to make it better for renal patients. But a
Mhm.
lot of the fight is up to you.
Mhm.
I've been dealing with that with some type of renal disease for 21 years now. And I think it's all about the attitude that you have,
Yeah.
But the thing of it is to be as educated as possible because it's your life. And it's just real important to know everything you can know about your disease, no matter what your chronic disease is. So if you could just give us some parting words, and I
Mhm.
just want to thank you so much. You're always available when we need you, and DPC really appreciates you. Thank you so
Uh,
much,
my
Joanne.
my pleasure. Well, just exactly what you said, Nance. So, I mean, you can train really anyone to do either PD or home hemodialysis. People can be evaluated for transplant. People can go into the clinic, but the big piece is you have to be involved. And I tell people as part of my education that these are all just procedures, right? We can do these procedures, but the toughest part is the head part, right? And that's
Yeah.
forever, right? And if you can't wrap your head around the fact that you need to change things that you're doing, you need to be more open, you need to learn things, you need to pay attention, you're not going to last long. I mean, I hate to say that, but really education will provide a longer lifespan for you. I
Mm.
can remember Nancy when she was on dialysis. She knew what was happening with the machine. She knew her goals. She cannulated. She put her own needles in. I mean, you have to be involved. Even if you choose in center, there's nothing wrong with that. But be involved. Know what's happening. Know what your arm should be. When they clean your arm, what does that look like? Know how much fluid they're pulling off. Know the significance of the fluid, right? Restrict the fluid, watch the salt, make sure that your doctor knows about any medications you're taking. The big goal is to keep people having residual urine, right? So a lot of people in center, for whatever reason, sometimes they stop taking their water pill, which, I mean, that you anytime your body can do something naturally, it's always much better, right? So then dialysis, which is a two process, so fluid removal and toxin removal, really becomes about the toxin removal, right? Because if you can continue to put out fluid, but you have options. And if you're not receiving education, you can demand that. I mean, I know Fresenius has kidney care advocates throughout the United States, so you should be able to just get online or talk to your nurse. And sometimes your doctor may say his opinion is that you're not the best candidate, but you know what, maybe you need a different doctor. I mean, I that's just the way it is, and I feel very strongly about that. Because
Mhm.
I know in our area, when I 10 gosh, oh my gosh, 20 years ago, when I started in home dialysis, there were probably 25 patients, and that was it. And they were handpicked because they would do everything they were supposed to do. But now the doctor's eyes are opened, right? So they know that everybody has the right. If you want to try home dialysis, and you can safely do that, there's no reason why you shouldn't be able to. I mean, if it takes you a little bit longer, so be it. We train you a little bit more, but you have the right. If you want to get out of that clinic and take care of yourself, talk to your doctor, talk to your nurse, your dietitian, talk to your PCT. They have the inside, right? They're the inside track. But I mean, it really is for most people, can do home dialysis or have a friend or family member that can help them with that. But just follow your diet, follow the restrictions, follow the doctor's orders, and you can have a good quality of life.
Mhm.
Yeah, I want to thank you for having me on. Always a pleasure, my friend.
Well, thank you so much. And everybody, thank you for tuning in. We do this monthly. Please look at our website. We're also on Instagram and Facebook, and it can also tell you everything else that we're doing. We're having an exciting time. And this is the last roundtable for 2025, but we will be back in January. So, everybody, be safe. Happy holidays, and thank you for joining in.
All right. All right. See you later.